Hi there, this is Navida Dolopo, and today I'm going to talk about fertility, but with a different twist. We're going to talk about men's feelings, and I think that's very important to discuss. I think I've done at least 17 or 18 videos at this point, and in probably all of those videos, I talk about women. At this phase in my career, I accept fertility patients, fertility clients who are willing to come in, both the husband and the wife. And this is very important because of a recent, the study's been out for a while, but if you watch my other videos, I talk about how 40% of fertility issues is because of the men. And I share in those videos, why then am I treating women? And rarely do men come in. It's usually the women. I think this is not fair, and especially when you look at the data. So I have shared this with every fertility client, and as of early July 2021, it is now July 22, I am only accepting fertility clients where both the man and the woman come in. Obviously, this is in regards to traditional natural conception, or even with IUI. So I want to point out that in the Mayo Clinic and also in the National Institutes of Health, you can find the study in regards to infertility. I use the word fertility, but in this case, we're going to talk about infertility. You can go to the mayoclinic.org. You can also find this on the National Institutes of Health. After I read this, I'm going to talk about men's emotions and feelings. Keep in mind, I am not a therapist. I'm not a therapist. I'm not a psychologist. I'm a licensed acupuncturist, and I'm sharing my experience that I have here since 1999 with fertility clients. So in regards to this study that is on these websites, in about 1/3 of cases, there is an issue with the man. In about 1/3 of cases, there is an issue with the woman. In the remaining cases, there are issues with both the man and the woman, or no cause can be found. So we can safely say that there's a possibility in these infertility cases that 2/3 of the issue may be with the man. So why am I treating primarily women in these infertility cases that I have? I make it a requirement in my practice now to have a 1-week screening process for anyone who wants to hire me as their licensed acupuncturist in regards to helping you achieve a strong, healthy, happy pregnancy, thus delivering a strong, powerful, vital baby. That is the end result. When I'm treating cases like depression or internal health issues, autoimmune cases, musculoskeletal issues, mental health issues, we can feel improvement. Oh, look, I can turn my neck. I can raise my shoulder. If the woman's coming in for hormonal issues, I can see that my women's, her time of the month is much better. In regards to fertility, there is one and only one success, and that's having a baby. So I will share this. In all my years of practice, I don't really believe that men truly understand the stress that women feel when a woman is trying to conceive, whenever her period comes. So it's important to understand that this study is critical to really pay attention to. So now that I've shared that, you know where I stand in regards to fertility. Men need to come a minimum of 4 times a month, and women have to follow a protocol, which I share on my, I send this via email and in private text to my patients. The recommendation for women is for treatment, if this is natural fertility, the recommendation is 6 to 12 cycles, 12 to 18 cycles, or 2 to 3 years. And I break that down in private. It's also broken down on my website. So if you go to elementsinharmonyacupuncture.com and you click on fertility, pregnancy, birth, if it's natural, I request 6 to 12 cycles if there is absolutely no medical diagnosis, so no Western medical diagnosis. 12 to 18 cycles if there is a medical diagnosis or one miscarriage. If there are 2 or more miscarriages or a severe medical diagnosis, I request 2 to 3 years. If you have any failed IUI or failed IVF, I request 2 to 3 years. So you can find that at elementsinharmonyacupuncture.com/fertility-pregnancy-birth. It's in black and white. You can see it right there. If you are an IVF client, I strongly recommend twice a week until transfer for 6 months or 3 months minimum prior to retrieval, 3 times a week, and then 3 times a week prior to transfer. So basically, until you transfer, you're coming in 3 times a week for 3 months. I don't deviate from that, or twice a week for 6 months. If you do not follow that protocol and it does not work for you, then please understand that you didn't follow my recommended protocol. I screen fertility clients for a very strong reason. I hope that my number of years in practice really reach out to your hearts to understand that I have your best interest at heart. I know how much people spend on IUI and IVF, and I want to make sure that you are set up for success. Same thing when it comes to natural fertility. Now, if your issue is with, if you are doing IUI, I also recommend twice a week for 6 months or 3 times a week for 3 months. Very similar. It is important and it is critical that you follow these protocols. Systems work. I have a few women who have just recently given birth and a few women who are about to give birth. So those topics I have brought up in other videos. What is going to make this video a little different is that I'm going to talk about men's emotions based on my experience in working and having worked with men using Chinese medicine. A lot of Chinese medicine is in regards to emotions. One of my colleagues had shared this article, What Miscarriage Taught Me About Men's Grief. It's on fatherly.com, and if you go to my website at elementsinharmony/daddies-hurt-2, I believe that is the page. I just want to make sure. You can find the article there. So let me just make sure I give you the correct URL. It is elementsinharmonyacupuncture.com, and it's dads-hurt-2, TOO. So that is a very touching article. It's not the only article that I've read about miscarriages and how men handle miscarriages, but this is a topic that really needs to be discussed, and I've definitely read the article. It's provided for you on my website. I wrote 10 concepts that I'd like to share, things to just keep in mind when we're acknowledging and bringing awareness to men who, we easily can forget that daddies hurt also. It's extremely painful for mommies to experience miscarriages, and women tend to make the time for talk therapy, but men oftentimes do not make that type of time for talk therapy. They either don't think about, or this, it's still a society where men's emotions aren't usually valued as much or asked. So again, I'm not a therapist, but this is something that I do want to share in my practice. I get the opportunity to listen to men frequently, and they're typically stoic. They listen. They come in for, number one thing they come in for is back pain. They're usually pretty straightforward. This is what I'm coming in for. Just tell me what I need to do. And I give them a protocol and they follow it. And they're pretty systematic. And I really enjoy treating men. When this clinic is all or mostly men, I get to get my work done much faster. Men are very straightforward and they usually talk much less than women. Pros and cons to that. So, here's some things that I've noticed as an acupuncturist. Men deal with stress and anxiety and sadness differently than women do. There's a therapist that I follow, Dr. John Gray. I refer his work on YouTube and him as a public speaker quite often. You can look him up on YouTube. He's written over 30 books. I believe his book, Men Are From Mars, Women Are From Venus, was on the New York Times bestsellers list for over 6 years. I really enjoy Venus on Fire, Mars on Ice. I'm looking to see if my book is over there, but it's a great book, Venus on Fire, Mars on Ice. It really helped me understand the way men's brains are and women's brains. But I think we can agree, most of us, that the way men handle stress, anxiety, sadness, depression is much different than how women do. I want to touch base on something that we don't discuss too often, and that's men being sexually abused. Women typically will put that down on their paperwork, being physically, mentally, spiritually, sexually abused, molested, raped. Men are not often quick to share that experience. I've had a few men in my practice, and one gentleman, we'll call him P, he didn't share until he was 38 with someone, and that was me. And he talked about how he was molested and raped by his brother as a child until his teenage years. And it caused him so much stress and anxiety and depression and grief. And oftentimes when we think about women, about people being abused, especially sexually abused, men are often left out of that equation or left out of that conversation, and I think that's very unfair. So something that I've observed is the way that men handle stress and anxiety, mental health issues is much different than how women do. For example, when I asked this gentleman once, where is your stress level on a scale 1 to 10? He said 7. At the time, I was helping him and his wife conceive. They have a baby now. I believe they have 2 now. This is many years ago. When I was treating his wife right after, she asked me what I was treating him for. Now, she has been in the room with him, so I did disclose I'm treating him for stress. And I just kept it at that because she knew that's what he would talk about. But she said, well, he's not stressed out. And I said, she said, when I asked him, he said he wasn't stressed out. I said, I didn't ask him if he was stressed. I said, where is your stress level on a scale 1 to 10? So it was very interesting because I typically don't ask men, are you stressed out? I'll usually ask them, where is your stress level on a scale 1 to 10? They answer that much differently than if I just say, are you stressed out? They answer it much differently. They don't always say, I'm stressed out. Because qualifying, having to qualify if they're stressed out is different than if I were to ask for a number. Men typically in my practice are quicker to respond to a number than having to think, am I stressed out? Whereas if I ask a woman, she'll say, I'm very stressed out. Just something to consider. I could be wrong, but that's just something that I've observed over the years. So the female patient, the wife, was very surprised. She felt a little offended at first. Like, he told me he was not stressed out. They drove down from Long Beach, and she asked him, are you stressed out? And he said no. But when I asked him, where is your stress level? He said a 7. So we're speaking the same language, or we're asking the same question, but in different languages, different words, if you will. The second concept is men do suffer emotionally, and oftentimes their pain goes unheard, and we dismiss their feelings, or do not even acknowledge that they have feelings. I'm going to say that again. Men do suffer emotionally, and oftentimes their pain goes unheard, and we dismiss their feelings or do not even acknowledge that they have feelings. I really like for you to sit with that. One of my homework assignments to some of my fertility clients is asking your husband, how do you feel? You may think that's a very basic question. Women, we love to be coddled, we love to be nurtured, we love to get attention, and we want to hear, how do you feel? And believe it or not, men like that question too. How do you feel? And they're usually taken aback, like, oh. So one of my fertility clients, I gave her that homework, and she asked her husband, we'll call him S, and he was like, wow, are you just asking because Anna told you to? She goes, no, I really want to know, how do you feel? And he felt special. He was surprised. They'd been together for, I want to say 10, 11 years. And he was really surprised that she asked, and she asked authentically. And she really put her heart to it. And she realized, wow, I don't usually ask that of him. And one of my other fertility clients, we'll call her Kay, she said the same thing, that when she asked her husband, how do you feel? He was surprised. Wow. Okay, so just keep that in mind. I've been married for 18 and a half years. And that's a question that I do like to ask my husband, how do you feel? Men are often surprised when I ask wives to ask men how they feel. So we discussed that. So make time to ask your husband, your partner, your boyfriend, how do you feel? Give them the space to share without them feeling that they're being judged. Let them express themselves. Satisfying men. This is the fourth concept. I gave an assignment a few weeks ago to ask their husbands, these fertility clients, my fertility clients, to ask your husbands how you can satisfy him. I don't care where you are in your cycle. And it was immediately taken, if not 100% taken, as if I'm going to ask my husband how to satisfy him sexually. And even though libido is important here in my practice, that's not necessarily what I was alluding to. You can ask your man, how can I satisfy you? He may not even be thinking sexually all the time. He may be thinking, for us women, help me with the laundry, that will satisfy me. Help me cook dinner, help me with the dishes, help me clean up the house, that'll satisfy me. Sometimes satisfying a man can include just leaving him alone, or just listening to him, or helping him with these tasks. It's not always sexual. So, and let's talk about the sexual thing. When I say ask your man how you can satisfy him, that doesn't mean that you necessarily have to have intercourse vaginally. So take that as you want, but I do want to share something. I've had multiple conversations with men for the last 22 years, but especially in the last 5 years. I'm in my 40s. I'm a lot more blunt than I used to be. I've got 3 kids. I'm cutting to the chase. I just want to get straight to the root of the issues with couples when it comes to fertility. I've had multiple conversations with men that have said over and over about how they feel used. They feel like when it comes to making a baby, they're just there for making a baby. And that is not fair, because they feel as if the only time their woman wants them is when it's time to conceive. So there's a website called babyhopes.com, and it's a blog babyhopes.com/blog/fertility/abstaining. Before I go over this particular before I go over this particular blog, I want to cite its resources. The first one is from PubMed. The second one is also from PubMed. And the third one is a translational andrology and urology. So you can see that these are valid, the high validity of the resources. Please read this. The article is called "Does Abstinence Help to Improve Sperm Count?" I'm not going to read the whole thing, but if you read it, it says that, I'll read this part. The samples from approximately 6,000 men, all of whom abstained from intercourse for up to 2 weeks. Let's see. Telltale sign that sperm health was rapidly declining. So the longer they were abstinent, the sperm health was rapidly declining. So studies show abstinence is mainly irrelevant for couples with normal fertility. They also show that men with low sperm counts can benefit from abstaining for a day or two. This ensures there is more healthy sperm available. Abstinence should not extend beyond the 2-day mark, as there is no benefit. So having sex every 2 to 3 days throughout the cycle ensures sperm will be available to fertilize the egg. You could read the rest of the article. In quite a few of my fertility videos, I state over and over and over that you should not only have sex during ovulation week. You should be having sex 3 times a week throughout the month. So that is a very powerful article, and you can go directly to the source of those PubMed, the 2 PubMed articles, effect of long abstinence periods on human sperm quality, and also relationship between the duration of sexual abstinence and semen quality, analysis of 9,489 semen samples, and the third article is analysis of semen parameters during 2 weeks of daily ejaculation, a first in human study. The blogger also cited the authors of these, and I'll share it here. Pellistor F., Girardet A., Andreo B. for the first article mentioned, Levitas E., Lunenfeld E., Wise N., Freiger M., Harvardi I., Koifman A., Potashnik G. for the second article, respectively. And then the third article is Welliver C., Benson A.D., Frederick et al. So definitely check out those. Again, you can find it at babyhopes.com/blog/fertility/abstaining, and those are on my website. So when we are satisfying men, usually, again, people assume that is sexually, but how about emotionally? Not nagging them and talking with respect to them. Ever since I've been giving some hopefully helpful gems, helpful activities to my fertility clients, they've been doing a lot more talking with respect to their husbands. I strongly recommend Dr. John Gray's work. I also recommend Dr. Joe Dispenza to study from his books. Number 5, taking the time to listen to men. Number 6, having sex with men, not just during ovulation. We discussed that. Number 7, making time and allowing space for men to share uninhibitedly and without judgment. Just letting them talk. How often do we do that? I did a video called Baddest Women Who Do What They Want, and I shared how I'll give you the synopsis of a 45-minute video. I did, it's one of my Happy Club videos, and I talked about how my husband called me, and he's not the yelling type, but he happened to be yelling that day, and I did several things. He wasn't yelling at me, he was just yelling. And women, we all have called our men yelling. And we weren't necessarily yelling at them, we were just yelling because we were frustrated. So I did several things. I stayed quiet, I listened, I let him speak whatever his truth was. I let him give his perception of things. I invited him to lunch. I took him to P.F. Chang's. I fed him food. I fed him a beer, and we resolved the issue. He did not feel judged. He did not feel like I was cutting him off. I did not yell back at him. I don't often do that, but we resolved that issue in 2 hours flat. Whereas that issue, based on what he was doing and how I normally would have responded in the past, which is reacting and also being emotional and yelling back and not allowing him to breathe or speak, and we're just going at it, we would have, that probably would have been like 2 weeks to 2 months of arguments and withholding sex from each other, and just not having a healthy communication, and it would, our kids would have picked up on the negative energy. So consider that, making time and allowing space for your man to share uninhibitedly and without judgment, just letting him talk. Really think about that and see how you would be able to behave and be able to let him talk and be able to let him share without assuming anything, that he's mad at you. He may just be frustrated. Women, oftentimes we get frustrated and we just want someone to listen to us, and we get very upset if they want to interject, and so they deserve the same respect. Number 8, giving men the opportunity to share their opinion without feeling hurt. So often they stay quiet because they do not want to sound mean or hurt our feelings. So I'm going to start bringing up miscarriages now. In that article that I was sharing about, the website on my URL, dads-hurt-2 Elements in Harmony, Acupuncture.com, and going to dads, the URL is Elements in Harmony, Acupuncture.com/dads-hurt-2. You'll see that article from fatherly.com. And it's important to remember that men do hurt. Men do suffer. They feel loss. And so often, women are the ones, typically, 99.9% of the time, where we pay attention to the woman's loss. We don't share the pain of the man. So, I'm going to repeat that. Giving men the opportunity to share their opinion without feeling hurt, to share their emotions. So often they stay quiet. Men stay quiet because they do not want to sound mean. They don't want to sound selfish. They don't want to hurt our feelings. Just something to consider. When men are here in my practice, I give them that space. I hope I give them that space where they feel listened to. They feel like someone actually cares. And sometimes women, as wives, as girlfriends, we're too close. We're too close to the elephant to see that it's an elephant. Oftentimes looking at art and being able to appreciate art, you got to stand back so you can truly see the big picture. And there's so many layers on a beautiful painting. And it's important to see that men have so many layers to them. So, again, I'm not a therapist. This is just stuff that I've noticed and observed over the last 22 years. And I do read a lot, and I listen to men, and I listen to male therapists who share their opinions and share their discussions and share their analyses online. You can find them on YouTube. And whether they're right or wrong, it's irrelevant. It's how they feel. It's how they perceive things. The factors of perception do matter. They do matter. Women, we want to be heard. So let's give men the opportunity to feel heard. Let's give men the opportunity to share in a safe space where they don't feel that we're judging them. Easier said than done. Number 9, make men feel like they're the king of the castle. So this is specifically for my fertility patients. Some of you have shared with me that ever since we've been working together, you can see the value of letting men be men. it's important for men to feel like they're the king of the castle. And this is going to be very humbling, and this may not be taken well, but women, especially if we're career women, we know what we want, we're going to get what we want, and no one's going to get in our way, and we're going to get it done, and you're going to do it my way or you're going to get out of the picture. And we have very little patience for a stupid answer, or someone who's not going to be supportive, and we want to be equal and everything has to be fair. And I can tell you, I truly believe that since 2009, I got married in 2002. My marriage was probably like everyone else's from 2002 to 2009. But when I started studying Dr. John Gray's work, and I started listening to my mentor, who's a man, and I started listening in 2006 to my Chinese medical mentor, who's a man, and really listening to how men think, I really took a step down just a little bit so my man can feel like the man of the house. So I would say since 2009, my marriage has been very blissful. We've had moments, and every time there was a moment, I listened to men, to my male mentors, to understand where Andrew was coming from. It's very easy for us women to point the finger and say, you're wrong, and I'm right, and I want you to do what I say, otherwise this isn't going to go well. How do you think men feel when we share that, when we see it that way? So again, these are observations. I've just noticed that when women take a little bit of heed on treating men like they're the kings of the castle, that their opinions matter, and they let the men take the lead. Obviously, this is a heterosexual relationship, that they end up getting pregnant. It's not fair, women, that we have to work less when we're wanting to conceive. It's not fair that, I can't put in as many hours, as my husband can at work. I've had to modify my life. Having a 17, 11, and 3-year-old, I understand the sacrifices. But those are sacrifices that almost every woman on the planet has to make. You're either going to make the sacrifices to make your work balance well with your kids, or you're just not going to have the great relationship with the kids. Mommy matters. I have a son, he's 3 years old. Mommy's relationship with my son, boys need their mommies. Girls need their mommies too. But we can't give less to our children. Well, let me say this. Men's feelings do matter, and children do need their daddies. But women, we have to make a lot of sacrifices. And those sacrifices are well worth making. You have to acknowledge that you can't work 40 to 60 plus hours a week and expect to conceive. And I've said this in many videos. If you want that picture, what you do today will dictate how you will be in 10 years. I'm 47. I have my babies. And there were a lot of things that I had to do. I had a lot of health issues when I was 20. So from age 20 to 29 is when I conceived. I gave birth at 30. There were 10 years of constant treatments in acupuncture and qigong, and a lot of things I had to do for my wellness. Receiving chiropractic as well. Doing all kinds of health things in order to live a healthy, strong life, so that when I was ready to conceive, it happened. So, that's number 9, making men feel like they're the king of the castle. I kind of touched upon making sure that I'm taken care of too. Acknowledging that it's okay to just a little bit. I know it's not taken well to say, letting him take the lead, but I'm speaking specifically about fertility, and I can only share what's worked for me and what's worked for my clients, and letting the man take the lead. And it's okay if things are not always fair. So read between the lines, and I apologize if I offend anyone, but this is a fertility video, and everything I share is specifically for women to understand a little bit how men work. My husband really enjoys it when I treat him like a man and not treating him less than me. Trust me, I'm a type A personality. I love to get things done. I'm, you know, I don't like to be necessarily called a tire mom, but I know in many ways I am. But at the end of the day, I have to let my husband take the lead, because the times when I didn't, there was not harmony in our home. And number 10, and I think this is the most important thing, you'll especially understand this if you study Dr. John Gray's work. Oftentimes, it helps to leave men alone. Just let them be and not be offended when they just need to sit down and be left alone. So I learned this from Dr. John Gray's work in one of his seminars, that after work, let him do anything just to relax for an hour, because he rejuvenates, his testosterone increases, and he feels happier. I don't expect my husband to help me with everything in the house so everything feels fair. Men usually don't want to feel like a deadbeat dad or a deadbeat husband. Let him relax. And I know women, you feel like, well, I've been taking care of kids all day, or I've worked also, and how come I don't get to relax? Dr. John Gray explains the reason why. I'll let you listen to him. I will just say, give men an opportunity to rest for at least an hour after work. And I will say this, when women say, you mean to tell me that after work you just let him do whatever he wants? And I can feel and I can hear the resentment. And I say, yeah, I let him do whatever he wants in order to relax, and I leave him alone. Because when he feels happier, I get whatever I want. I remember one time there was this conversation that I had with a woman. I helped her get pregnant, but in the beginning, she was very upset. She felt a lot of resentment towards her husband. And I said, well, when I do these things to make my husband feel like a man, I get whatever I want. She goes, well, I get whatever I want. And I said, yeah, but I get whatever I want without yelling. I said, when you get what you want, do you have to yell for it? And she admitted she does. Things can go a lot more smoothly with your husband, your boyfriend, your partner, if you're just a lot sweeter. And I know in this cancel culture, something like that can be taken abrasively. But people usually respond well, much better, when you're sweeter to them. Recently, I've had some people being hostile. I don't respond to hostility. People usually do not respond well to hostility. I would recommend that if there's something that you want, that you treat that person with respect. In this case where we're talking about fertility, you want to treat your husband, your boyfriend, your partner with a lot of respect. So I hope that this was a very, very helpful video for those men who've ever experienced miscarriages. I want to say from the bottom of my heart that I'm very sorry, and I know that you have suffered also, and I know that it has been painful for you, and the only person who really can understand is you. Your wife, your partner, your girlfriend has suffered also emotionally. If you feel that talk therapy would be helpful, you may want to consider doing that. There are many things to help with sperm motility, mobility, morphology. Acupuncture and Chinese herbs can definitely help. You don't have to see a doctor of acupuncture and Chinese medicine. You can see a naturopath, you can see your Western medical doctor, you can see your urologist, you can see a chiropractor, you can see a naturopath. There are so many different routes to go. But I do recommend that you check your sperm quality. If I am quoting Dr. John Gray correctly, the average man who's 40 years old now has a testosterone level of a 7-year-old man 30 years ago. I apologize if that data is incorrect, but that's the information that I've been taking notes on. Please do check your testosterone levels. Please do make sure that your numbers are good. Make sure your blood pressure's normal, ideally around 120 over 80 or something like that. Make sure cholesterol numbers are good. Make sure that you're exercising 3 to 5 times a week. Make sure you're doing weights. It helps with building testosterone. Make sure you're doing cardio. Make sure you drink a lot of room temperature water. Men need to live very healthy lives, and make sure you're mentally well. My dad was in the Navy for 20 years, so was my father-in-law, and my husband's grandfather was registered as the first Filipino to serve the U.S. Navy, and my niece's husband is in the U.S. Navy, and I have quite a few friends who are in the Marines, the Army, the Air Force, and the Navy, and Coast Guard, people in law enforcement. I have friends in law enforcement, firefighters. Men serve. There are a lot of men in my family and my friends who serve, and you owe it to yourself to deal with PTSD. A few years ago, I did the 22 kill or something like that, and supposedly every 22 minutes there's a suicide. Do work with someone when it comes to your emotional health. Group therapy, talk therapy, acupuncture is very helpful for mental health issues. So this was about the men today. This was definitely about the men today. And if this was at all helpful, please share this with your friends. I want women, more women and men, no matter what sexual orientation you are, I want men to feel like, women do care. And violence towards men does happen. In a heterosexual relationship, there are women who are abusive to men, physically violent and emotionally violent. There is violence in gay partnerships, women to women, men to men. That is never, I grew up in a dysfunctional household. That's never acceptable. So with respect to men, I strongly recommend that you find a way to express yourselves and don't hold it in. Go to a talk therapist, really highly qualified. If you need to see a psychologist, a psychiatrist, if you want to try Chinese medicine, acupuncture, herbs, or whatever healing modality, I want men to know that your health does matter, and not just physically, but especially mentally and emotionally. My website is elementsinharmonyacupuncture.com. My cell phone, you can text. It's a private number. It's 619-341-4341. My office number, I'll get back to you much faster via text. Office number is 949-305-1703. If you're a patient, you can upload any of your documents on the AcuSimple, or you can email me at anna@elementsinharmonyacupuncture.com. Have a great day, and thank you for watching this very long video. Take care.